I'm Rebecca Gordon.
Hi, this is Sylvia Gordon. This is how I feel about the world right now. I'll wear the shirt special for this edition of the Wednesday wrap-up. Stay tuned. We're going to talk about
A brand new COVID-proof AEP program.
why should I yell?
That's how I feel about the world. Stay
How I
tuned.
feel about the world. Let's talk about insulin first, because that's good news. Let's live with some good news.
Oh my gosh. Yes, insulin. So, I don't know
The
if you
insulin
all...
prices have skyrocketed.
They're skyrocketing.
I don't know if you know this, but
She does.
I don't know if
she does this.
Okay, but anyway.
This is
okay,
my
but she
life.
says I was interrupt her.
She always interrupts me.
Okay, but I feel
In fact, hit a comment how many times she does interrupt me throughout the last
you're a
2
big
years of our
sister,
show.
if you're a big
It's
sister,
nonstop.
it might be a thing.
I'm gonna tell Mom.
With
Mom!
Insulin, it's good news. What happened?
If you watch the news, you know that people are taking buses to go to Canada to buy their insulin because it's so expensive here. So what has happened is a lot of the carriers had to file by June 1st to lower the insulin copay for Advantage plans and Medicare plans. Am I right?
Not messed up. Advantage plans and Part D.
Part D! I was waiting for her to just interrupt me, so I really didn't study
I know you got nervous.
Because she's
The
just
good
like-
news is the administration is leading the fight to lower insulin costs. Let's just say, because it's an election year and seniors vote, and this is a win because this is going to save, CMS estimates this is going to save the average beneficiary $500 a year. Okay.
Oh my God, I would think, yeah.
I would think more, but anyway,
Way.
but they're gonna cap out the copays at $35 a month on many insulins. So I don't know
Yeah.
the list yet. Erin said she had the list, so she said if you want the list, because she went home sick. She said if you want the list, ask us in the comments and we will send you the list. Because I was like, Humalog, Novolin, what?
That's a big deal though.
Yeah, Metformin,
God,
what is it?
Insulin is huge.
But they had to, so the government came up with the program and the carriers had to apply by June 1st. So they've already applied, the ones that want to do it. And it's not for right now.
Right, 2021.
So that's good news
This
for your
AEP.
consumers. That's something positive that agents can talk about during the upcoming AEP. And soon we will know what carriers have applied to participate. Oh, I have a graphic here.
Sylvia's in charge of the graphics.
Insulin.
Oh, there it is.
That'll be a win. So that'll be a win for you to talk about on social media to your clients, positive news to put in your newsletters to your clients, and definitely to take to the field because everybody needs something positive right now.
Everybody dug it. Well, I want to talk about our COVID-proof AEP program. Medicare by phone.
Ta-da!
Ding! I'm going to do like in elementary school when you hear,
Ah.
ding, you turn the page. Medicare by phone. We are super pumped about this. This is, we're taking our most successful, or teaming up with our most successful call center and to teach street agents how to do what they do. I think anyone who doesn't think that COVID is gonna flare back up in the fall, potentially, what?
So I don't think you can say our most successful call center. I think you need to say agents that are selling by phone because there's a difference.
I'm trying to give a compliment to our call center.
I know.
And now she's disrespecting you. So I don't know how you feel about that.
No, they know they're not a call center. They sell by phone.
Then let's cut and
Because
redo
to
it.
be a call center,
Then, well, they don't know who it is.
it says it right here.
Oh, let's
To be a call
let's
center.
cut that out then. Cut that out.
I don't know, I actually think it's a good distinction. People need to know. To be in a call center, it's very rigid and regulated.
Very regulated, a lot of rules.
The calls are recorded. And
All right, well, if
there's
we get
a
in any
whole-
trouble, I tried to redo it. So
No, but I'm saying, but these agents aren't in a call center. They're learning to sell by phone.
They're learning to sell. They're learning the model of
Right,
selling by phone.
and how to do it legally,
Yes.
basically by phone, not in a call center.
Yes.
Okay, I mean, it's a distinction the carriers definitely understand.
It's a big deal for an agent because when we look at like dips for this year, or when we're talking to some of you, it really, a lot of us just don't have the skill set to do the sales over the phone. And if we get another lockup, if we get another flare up, another quarantine, it could crush a lot of people's biggest time of year for income.
I mean, a lot of agents are still not selling right now. They're still stuck.
So we are thrilled that we are rolling this out. It's called Medicare by Phone. If you are interested, there's some rules and stipulations to be on this program. It's not for everyone. We're looking for street agents.
So independent agents, no upline.
And you know,
And what do they teach
the
you?
system. They're gonna teach you how to do the calls, work the leads. It's like a 30-day program where you check in with your coaches, I think, every day.
Do you
maybe
pay
2 times a day.
Do you pay to be on the program?
There is a pay, you do have to purchase, well, you're on their 5-9 system and also for the leads.
What's 5.9, like $50 a month?
5-9, it's all together, so I don't wanna say what the price is, it's under like
When you're on the
700.
program, they supply the leads that you purchase and they teach you how to work the leads.
100%,
And if they can do it and be as successful as they are, you can too.
no question. So
Just do what they do.
hit us up in the comments, because we're gonna start launching these training classes and getting people for our soft launch on the program, but we wanna know if you're interested and this is something you need to know how to do, which is probably a lot of people, let us know, we're pumped.
Or if you're trying to bring in a new agent, because I know a lot of guys, they're trying to
Perfect.
bring in their son or daughter, they're younger.
Absolutely.
Yeah, this is the time.
Perfect. Medicare by Phone, I'm super excited about it.
Okay, you have
Okay.
a bonus you would like to talk
Oh
about?
my God, so I just got off my call with my buddies Anthem and my bruh, Bobby Taylor from California, super cool guy. And they have a crazy awesome Med Sup bonus. It's now through the end of the year, and it's really hard to understand. It's $200 an app. All Med Sups, unlimited.
On the East Coast,
West,
West Coast. How many
California,
states?
Arizona, Colorado, Texas, Nevada, 7-1 to 1-1. $200 an app. $200 an app.
And
The heck, that's awesome.
are their rates any good?
Can we say ka-ching-a-ling?
Are the
Their
rates
rates are good. They're very good.
That's the thing, is people throw out
Right.
a bonus, and
Right.
like, I
And they
look at the
suck.
rates, I'm like, I'm never gonna touch that, don't waste my brain space with
They're-
that. When their rates, like they had that bonus in New York, people were cranking it.
Yeah,
The rates
they were.
good, the bonus was
The
good.
bonus was good.
Yeah,
It
so,
was. This is awesome. We're super excited
so if
about
you
that. They've
haven't
been great
looked,
partners.
if you haven't looked at Anthem's rates and you're in the West. Look at them again, because there is a very attractive bonus.
Huge bonus. They also have a bonus in the East.
How much?
Can I give it up to cutie Mr. Steve Muir? All right, this is Connecticut, Maine, New Hampshire, and Georgia. Not as easy as the West, but 1 to 4 apps is a $150 bonus. 5 to 9 apps, $250. 10 apps plus, $300.
And people, they're,
What the heck?
throw your pin.
What's that?
People,
That's a pin thrower. Oh, that's 7-1 to 9-1 also.
people that are equipped and able to sell by phone, they just switch their focus and they
Right.
chase those bonuses.
Easy.
So if you're a street agent, you still go to their houses, you can't take advantage of a bonus in Colorado. But if you can sell by phone,
can
and you
sell by
don't have to
phone.
be strictly sell by phone, you can add
Right.
it to your arsenal of tools, then you can chase.
That totally
Those
opens you
bonuses.
up. That opens you up to the whole country of bonuses.
If you're not thinking globally like that, I guess it's not globally, nationally,
And you're not thinking.
yeah, because this business has drastically changed. It's not just you working your backyard anymore.
If I don't mention that Central has a bonus in Anthem, I'm gonna get in a lot of trouble because Central, they're my peeps. They have a med set bonus also, and I don't have
You should
all
like
of it.
leaning way up in
I'm
there.
leaning it in here.
Are you zooming in on
I'm
this?
coming in. I have new lipstick
What is
on.
it? What is the bonus?
Okay. I don't have all the rules down 100%, which isn't really, but I do want to give a shout out to Neil Stevens, or Steffens. I'm not exactly sure how to pronounce your last name, but he is the new president of Central Region
Oh, really?
with Anthem.
Who do you replace?
David McNichols, one of my favorite
Oh, I
people
like
of
that
all
guy.
times.
Yeah, he's a good
Super
guy.
awesome. So Neil,
Big shoes to feel.
big shoes
Phil, I
to
cannot
feel.
talk today. To fill.
Welcome.
Welcome, Neil.
Welcome, Neil. Lastly, Anthem does have their SCP through the end of June. You either select natural disaster or other.
And that's the thing, is everybody, they're calling in, they're like, what is Aetna calling this SEP? And what is Humana calling this? What? And they're all
Is it a natural
calling-
disaster or was it chemically made?
Yeah, they're all asking the question that varies by carrier. You try to find something FEMA-ish.
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 Well, why don't we wrap this up?
Wait.
Oh,
I just want to say United Healthcare still has not opened contracting yet.
Why are
Okay,
you doing
well, I think
this
we're
to
getting
us?
closer, but it's a huge task to recontract everybody. And we still have people that have not filled out their contract. The deadline is coming.
You're going to be mad when you lose your renewals because you didn't do it.
And you're gonna be mad when you get
You're
terminated.
gonna be mad.
And you're just gonna be mad.
And-
So get at it right now, ask your assistant if this is something that you give off to somebody else in your staff, because they might have thought, oh, I don't need to do that. You do. Every agent in the whole country needs to do it.
Good God.
And if it's not done, there will be repercussions.
We can do more. We can do no more than
Yes.
what we are doing.
The deadline is approaching. I think we are calling everybody that hasn't done theirs yet.
Again.
And typically, it's the same thing we've talked about for weeks now. They have a different email, so they're not
Right.
getting the link.
Right.
We can't send it to you. We can't resend it to you. You must call United Healthcare's producer help desk. Tell them that you don't have it, and they will resend it to the new email you're going to give them.
Be proactive.
So please talk to your staff. If you don't personally take care of that, you must do it before the end of the month.
Also,
And
make
I have a
sure
giveaway.
to
I have a
subscribe to our channel.
Oh yeah, we're almost at 5,000 subscribers. Thank you guys for tuning in week in and week out. And if there are any Irish people out there, I did find this in the garage and didn't want to throw it away, add to the landfill.
We are not
So
Irish.
if anybody is Irish, ask me in the comments and I will send this to you for your man cave or your she shed
Well, she
instead of
shed.
throwing it away. I'm gonna upcycle it to you. Thanks for tuning in. Talk to you guys next week.